Hi, my name is Leslie Samulak, and I'm a doctor of occupational therapy. This presentation was developed to be a brief overview about the role of occupational therapy in caesarean postpartum rehabilitation. Therefore, not all information regarding this topic is included or discussed in detail. On a side note, occupational therapy plays a significant role in all postpartum care. However, this presentation is specific to C-sections. As a nation, we may be a leader in technological advancements, but the U.S. has one of the worst maternal morbidity rates in the developed world. We lack in supportive women's health care, specifically during postpartum, and this is a main cause of poor maternal outcomes. For example, did you know that a C-section is the most performed inpatient surgical procedure, and maternal and neonatal discharges account for nearly 1/4 of all hospital discharges per year? This creates a massive opportunity to refer to occupational therapy. If you consider the different specialties of surgeons, all of them except for OBs routinely refer clients to occupational therapy services for post-surgical rehab. Even if you think that maternal health practices are attempting to trend away from C-section deliveries, cesarean deliveries will not disappear, and a significant number of mothers will still need postpartum rehabilitation. Most importantly, referrals to occupational therapy services for postpartum rehab illustrates progressivism in women's health, which goes a long way in patient care. The Surgeon General's call to action to improve maternal health in 2020 identified 5 levels of missed care opportunities. So how can occupational therapy fill in the missing pieces? At the community level, occupational therapy can provide in-home or telehealth postpartum care services, which allows greater patient access to clinical care, specifically for mothers who lack adequate transportation, mothers who cannot find childcare for postpartum appointments, mothers who feel unready to leave their homes, or mothers in remote rural areas. Additionally, health management is within the scope of occupational therapy practice. Therefore, individuals with chronic disease will also be included in the postpartum care services. Most significantly, occupational therapy is already established as a prominent provider at the community level. At the health facility level, you may be thinking, do we lack in discharge education? According to a 2019 study in Nursing for Women's Health, despite the valuable nursing time devoted to discharge education, many distractors have been identified by women during the first few days postpartum, which made it difficult to remember the information during the discharge education. Also take into consideration that postpartum recovery hospitalization is typically only 2 to 4 days. Does this mean that the length of stay should increase to improve quality of care? According to women's reports and postpartum support groups, women do not prefer a longer length of stay. At the patient and family level, occupational therapy services can provide the patient, family, and partner with education regarding warning signs and symptoms of physical and mental health issues while also addressing non-adherent strategies for higher compliance with medical regimens or advice. This can be a pivotal area of improvement for maternal health outcomes. At the provider level, perhaps you are thinking that the postpartum appointment just needs to be scheduled earlier than established at about 3 to 6 weeks. A 2017 article written by Tully et al. Found that women have multiple unmet clinical needs beyond the concerns addressed by their OB at the postpartum appointment. What this is suggesting is that no matter when the follow-up appointment is scheduled, mothers have additional clinical needs that are not being successfully met with the information provided during that appointment. At this level, referrals can be made to occupational therapy services to address those unmet clinical needs and remediate the lack of continuation of care. Also, occupational therapists are multifaceted and can screen for various physical or mental health issues, which can positively influence the missed or delayed diagnosis during postpartum. For the system level, the addition of occupational therapy services to the maternal health care team will alleviate the inadequacy receipt of care. With the enactment of these referrals, postpartum care is setting a new standard. Additionally, occupational therapists can help play a key role in coordination of care with clinical screening of postpartum women and referring to other service providers as needed. As you can see, occupational therapy can meet the demands of multi-level organizational failures and positively influence maternal health care outcomes. At this point of the presentation, you may have buy-in. So how can occupational therapy be marketed as a healthcare professional suited for cesarean postpartum recovery? Becoming a mother needs an occupation-based therapy. This is a major life event, is not a condition. Think about how occupations are changed after the birth of an infant. Think about how the performance of our occupations are altered while recovering from a C-section due to neuromuscular and musculoskeletal changes and pain. Additionally, motherhood involves numerous stressors, and when our bodies are inundated with stress, the nervous system becomes disorganized, which in turn affects our higher order executive functioning skills and negatively impacts mind and body healing. Therefore, the clinical needs of a postpartum mother require physical, cognitive, and mental health strategies, which all can be provided through occupational therapy services. Here is where I think my profession falls short with being a more recognized healthcare profession. It is the inability of other healthcare professionals and the public to grasp the purpose of occupational therapy. So the definition of an occupation is defined as everyday personalized activities that people perform as individuals, families, and communities to occupy time and are meaningful and purposeful to life. In other words, all the daily activities that you perform in the way that you perform them, that includes your roles, habits, and routines. For example, the way I do laundry is most likely not the way you do laundry. The name of the occupation is the same, but the components of the performance are not the same. The categories of occupations are listed on the slide, and I just wanted to highlight a few key points. ADLs, or activities of daily living, are the most traditionally known occupations. Self-care is a subcategory of ADLs, and these needs will be the most important to address immediately after childbirth. I want to also bring attention to the occupation of sex and intimacy. This is a topic that concerns women, but is often not addressed during the postpartum appointment. IADLs are noticeably disrupted during postpartum recovery, and these include home management-related occupations and childcare. Health management during postpartum provides a significant opportunity for occupational therapists to monitor postpartum complications and chronic diseases or conditions. Rest and sleep. A mother during postpartum is transitioning to a predominantly new role in her life while operating under a substantial lack of sleep. Leisure is important for psychosocial needs as it provides time to disconnect from the stress of mothering and maintain well-being. Social participation is also important to prevent isolation, which can amplify symptoms of maternal mental health conditions. Social participation includes intimate partner relationships, which is a popular concern during postpartum that results from feelings of partner inequity. Occupational therapists can provide partner relationship education and implement strategies to improve partner support. Experiencing a caesarean birth does not exclude a mother from pelvic floor disorders. A systematic review and meta-analysis found that short-term pelvic floor muscle function after C-section did not differ from vaginal delivery. However, differences did occur in women who experienced an episiotomy or instrumented vaginal delivery. The risk factors for pelvic floor disorders include the weight of the baby, 8 pounds or more, which creates significant pressure on the pelvic floor, and a paradoxical breathing pattern due to the limited space for the diaphragm. Number of deliveries. Did the mother undergo rehab after previous deliveries, particularly for scar management, which can create a multitude of issues? Duration of pushing. Perhaps the mother attempted a vaginal delivery before requiring a C-section. Respiratory conditions with chronic coughing or sneezing. This includes mothers who had COVID during pregnancy. Constipation. And pelvic floor issues prior to delivery. Pelvic floor disorder may have existed before the delivery, but worsened after pregnancy and during postpartum. So how do occupational therapists clinically address C-section recovery? This slide lists some of the various interventions that are used for postpartum rehabilitation. Occupational therapists consider the client's personal goals and translate that into clinical-based interventions for positive functional outcomes and overall client satisfaction. We are uniquely trained in task analysis to assess the dysfunction of both motor and process skills during occupational performance. We also consider routines, roles, and habits with cultural competence that are all personal to the transition to motherhood and the process of mothering. Then we use our extensive skills to educate and teach the client new strategies to alter functionality and to improve performance outcomes for a better quality of life.